Good morning, guys. It's Maggie and I am back today. Zach just came down, so he has Nova right now. Hopefully we're gonna be chill. We just ate a little bit and had a major blowout, so that was a little fun. Yeah, Zach handled most of it. I handled one the other day that was a lot. So anyways, today I thought I would do sort of a health update for you guys, but it's going to involve the doctor's appointments that are needed for these health updates, because there's a few things that I've been talking about I want to take care of. So that's what I'm going to do today. I'm going to get over to my computer here. I need to make sure that I have my insurance card ready. I already wrote down the phone numbers. I did already schedule one appointment, which I'll talk to you guys about. And what else do I need? Do I need my license? I needed it for one of the appointments. I had to take a picture and send it in. So let me get myself set up on the computer here. But actually first, let me thank today's sponsor, Element, who's been helping me with my everyday health. Okay, so you may hear Nova in the background. That is life these days. That's how it's gonna be. I have my Element here because you guys know it's my favorite zero sugar electrolyte. It is the way that I stay hydrated every single day, which is something that is very important to me as somebody with an ostomy, as somebody that's breastfeeding. You gotta stay hydrated. So I'm just choosing my flavor here. I have raspberry, grapefruit, lemonade, watermelon, and orange, and I think I'm leaning towards the orange today. Again, kind of been enjoying that one a little bit more. So yes, it is my favorite way to stay hydrated. It's got 1,000 milligrams of sodium, 200 of potassium, and 60 of magnesium. They come in these little packets that you just pour into water. I've got my cup here has seen better days, okay? You pour it into your water, and then you mix it up, and you're good to go. And I like to sip on these slowly throughout the day. I think it's the best way to stay hydrated. When I worked with nurses for ostomy care, I did some telehealth ostomy nursing, not as a WOCN, but as just an RN. We always recommended electrolytes to our patients because, you know, you get dehydrated pretty easily with your ostomy. And since finding these guys over a year ago, I feel like it's made such a difference. It's absolutely been the best one that I've tried over, what, the 15 years that I've had my ostomy. So highly recommend them. It helps me get rid of brain fog and fatigue and headaches. I feel like I have this very certain feeling, I don't know how to exactly describe it, when I start to get dehydrated. It's a headache that's sort of central here, and I just start to feel dry. And that's when I know, okay, I need to catch up. We need to get some Element on board, and I'll start, you know, making my cup up. So anyways, Element is offering a free sample pack with any order by going to drinkelement.com/LetsTalkIBD. That's DRINKLMNT.com/LetsTalkIBD. I've been talking about the lemonade flavor, but they have been selling out, so you definitely want to grab that before they're out. They are considering making it a permanent flavor, but that's not a guarantee, so don't rely on that. Get your lemonade salt or try any of their other flavors. I love them all. They're not too sweet, they're not too salty, and they do the job. So thank you so much to Element for sponsoring this video. Okay, I gotta get myself together here to figure out who I'm calling. This is your motivation, okay? This is your motivation today. If you've been putting off scheduling appointments like I do. How long have I been putting off all of my appointments, Zach?
Which one?
Any of them.
I plead the fifth.
Yeah, it's
a while.
Do as I say, not as I do. That's, yeah. Okay, so the first appointment that I scheduled this morning was for Dermatology. I actually had somebody comment, I think on Instagram maybe, about a mole that appeared around my ostomy. And it's actually, I think, the first one that I started to notice. I don't know when it popped up, but it's dark and it's there, and they said, hey, that looks concerning, which I agree. I don't know if there's anything wrong with it, but I've had a number of other ones during pregnancy. I had a bunch, and I actually have one on my left breast, and that one I had talked to actually my OB about it, and they recommended a dermatologist, and I was so fearful that it would interfere with breastfeeding if something was wrong. So I put it off, and that's a stupid thing to do. So I finally made the appointment. I was able to make it online, and so I've got that coming up in just a few days before Zach goes back to work, which is very soon. I'm sad. But at least I'm gonna get that taken care of. We're gonna look at all the different spots because as someone who was previously on 𝙗𝙪𝙨 for my Crohn's disease, they tell you that you should get yearly skin checkups. It can make you a little bit more sun sensitive. And skin cancer does run in my family on my mom's side. So, you know, it's something that's important. But the funny thing is, all of the areas that I've noticed have changed are not areas that are often exposed to sun. So like my ostomy, my chest, I don't know why that would be happening, but I know I need to get it taken care of, and I've put it off probably a lot longer than I should have. So that was the first thing. The next thing, I don't know what I did with my phone. I'm gonna need my phone to call these people. Okay, well, ignore my desk, by the way, because it's a mess. Ignore my desktop, actually. Yeah, I'm not the most organized person. Let me go get my phone for the next two that I have to make. Okay, got my phone here. So the other two things that I need to take care of are pelvic floor therapy, and the second one I'll talk about in a minute because it's sort of a weird one. Pelvic floor therapy. I have been to pelvic floor therapy in the past after I had my rectum removed. There were a lot of pelvic floor changes. I lost a lot of support of basically all the organs down there, it felt like, and I had a lot of pain. Learned that my muscles in the pelvic floor were trying to overcompensate for the loss of support from the rectum, and so everything got really tight and painful down there. And that was sort of interesting to learn. It took me weeks of pelvic floor therapy. I started I think twice a week, and then we were able to go to once a week. This is over the course of 3 months. That's crazy. And then I continued exercises, but you know, as life goes on, you fall off on doing those exercises. And then of course I was pregnant, and I feel like my pelvic floor was the best that it had been. You know, it felt like everything was really comfortable and good down there. I don't know how to describe it. Gave birth, and now I feel like I'm right back where I was when I had my rectum removed. Maybe not quite as severe, but it definitely feels like there is muscle tightness down there, and I don't want to let it go too long. I mentioned how my hope is that Nova will not be our last baby. I loved pregnancy. I loved delivering. I love having her, of course. So, you know, we're hoping for more. So I want to make sure I take care of these things as soon as possible. But there has been some uncomfortableness, and that isn't great. I know a lot of people struggle with urinary problems after they give birth. I don't know if I've noticed too much of that per se, but it's maybe that's because things are tightening again and they're maybe holding that together. I don't know. I don't know what I'm talking about when it comes to this. That's why we're going to go to pelvic floor therapy again. And we're going to cross our fingers that we can get an appointment. So why don't we give them a call? The good thing is the place that I'm going to call is right down the road. It's next to my primary care. It's actually like affiliated with them, so they should have all my info already. And I did check, of course, my insurance is taken there because it's through the same hospital system that my primary care is through. I did look up reviews. The person that does the therapy is, there's only good things that they say about her, so I have no idea. This is a totally different place than where I went before, because the place I went before, the person that did my pelvic floor therapy is no longer there. Don't take a drink every time I say pelvic floor therapy, by the way. You will be flat on your butt. All right, let's give him a call. Do I have my insurance card? Yes, I do. I was wondering if I could make an appointment for pelvic floor therapy. can I schedule for the 8:30 one? Awesome. All right. Is that all that you need from me? Okay, good. Thank you. All right. Have a good day. Bye-bye. Ugh. Okay. So, they didn't have an appointment until October 13th. That sucks.
Is that the dermatologist?
No, that was pelvic floor therapy.
Oh.
Now I'm like, maybe I should call that other place and just get a price.
Can't hurt.
You think I should? Dang, ugh.
Maybe with some exceptions or like a medical, I don't know, maybe it'll take your insurance.
Well, they said that you could like submit, hold on, I'm gonna pull up this other place now, because
Oh, then maybe they'll help you out with that.
October 13th is
You
really...
can't be the only person that uses them.
No.
With
They have, so what she was saying was that they only have one person that does pelvic floor therapy, and she only works part-time. Yeah. Shoot. Okay, so this other place is like a whole team, and it seems really nice in their office, but you have to pay out of pocket. And they do say that you might be able to submit for reimbursement, but every time that I've ever tried that, it doesn't work, and I wind up being stuck, you know, having paid. Okay. I was interested in pelvic floor therapy. I'm about 3 months postpartum, and I just was hoping to get some information. I'm having some pain, especially during intercourse. I have a history of Crohn's disease, which involved rectum removal. I had my colon and rectum removed in 2019. And so I have been to pelvic floor therapy in the past due to like muscle tightness. I guess my body was trying to overcompensate for the loss of the rectal support. And I feel like postpartum, it kind of just went right back there. So that's why I was interested. Okay, perfect. Awesome. Okay, I made appointments with the out-of-pocket place. What she told me is that I will give my doctor, my OB's info to them. They can submit for reimbursement for me.
The OB can.
The OB with the pelvic floor therapist. Like they basically they need a referral or a prescription for pelvic floor therapy from
That's what I said. I thought it was going to be like...
the OB. They will do the contacting directly, but I might give the doctor a heads up. I'm sure that he would do it for me. Because, like, he knows my history.
Yeah.
They would submit, but I have to pay up front.
How much is it?
It's $225 for the evaluation, and then it's $195 for every follow-up, and I would go weekly. I scheduled for Mondays at 2 p.m.
How quickly is the reimbursement procedure process?
That I don't know.
Because that could add up quick.
I know.
Hey.
But they were so lovely on the phone.
I know, I can tell.
I was like, oh, okay, let's go. They were so nice, and it's in Doylestown.
You have to make sure they're good, though.
Well, I'll do the eval, and if I hate it,
Yeah.
I'm out $225. Potentially might get reimbursed, but I'm out $225.
So the reimbursement would be your OB submits to the insurance?
Yes, and here's my thinking too, that I'm doing it now when I've already met my max out of pocket. Hopefully, with my history and meeting the max out of pocket, maybe I'll be fully reimbursed. I have no idea. But the thing is, they could see me sooner. They can see me September 8th.
Oh, is that when you would go?
Yeah. So it would be Mondays at 2 p.m. And we can try to aim for me to get her like sleeping when I'm there. But it's only in Doylestown. It's not like going to Lansdale like we used to. Okay. There we go. So that was that. I'll keep my other appointment for now.
You want it as a backup in case the other one doesn't come through.
Exactly.
Please. Whatever.
And this is my thing too. If they couldn't schedule me till October and they only gave me one appointment, usually like pelvic floor therapy, you go a few times. Yeah, they would be like, all right, we'll see you in another couple months.
I thought you were doing twice a week almost beforehand.
I was. They said what they would do was an hour-long eval. The appointments are an hour long. You get the person the whole time.
How long were they before?
They were probably about an hour.
Okay.
Because remember, you used to walk the dogs.
Oh,
And they'd
yeah.
bring me. Yeah. So, all right. So, I got to get Nova real quick. And then we will call the next one, which is a podiatrist. An issue, a doctor I've never had to deal with before. All right, I'll catch up with you in a little bit. It'll be a flash for you. Okay, Zach has Nova again. He's got her in her little chair while he showers. Yeah, podiatry. This is something I've never had any health issues with. I like to keep my feet pristine, okay? And sometimes feet gross people out. Zach hates feet, so I feel like I can't even show him. But anyways, I think, as you may have seen, at the end of my pregnancy, I was quite swollen. My face was swollen, my legs were huge, my feet were huge, I didn't fit any shoes, and I don't know if maybe it's because of that. Things shrunk back to where they were, you know, I'm not swollen anymore. I am dealing with ingrown nails, which is, it's gross, and it's to the point where I have a little infection on both feet. It's grossing me out. They're not healing. I don't know what to do about them. I have tried soaking my feet with, you know, salt and warm water. I don't really want to mess with them too much more because they are, I believe, infected, which sucks because I don't, hopefully it's something where they can maybe handle the ingrown, do whatever they do. Our friend had issues with that and he said that they basically numb your foot and cut away the skin to help, you know, expose the nail more. I had like, you know, every once in a while I'll have a sore spot before pregnancy, but it would resolve within a day. So I didn't really think too much of it. And now it's like painful and annoying. I'm looking at my toe right now. It's being a pain in the butt. Pain in the toe. So I'm going to call a podiatrist, which is, I've never done this before. Don't know what to expect. It's all these like stupid little health things that pop up. And normally I would just be like, you know, let it heal. It'll probably fix itself in a few weeks. But it hasn't. And it's bugging me enough that I feel like I need to call somebody about it, do something about it. So that's what we're going to do. All right, let's call the podiatrist now. I just Googled one. I don't know what I'm doing. And I was hoping to make an appointment. I'm dealing with some ingrown toenail issues. No, I'm not. Okay, that would work. Okay. Whew. Got that one scheduled too for mid-August. What am I saying? Oh my goodness. My brain feels like mush. Mid-August. So I guess my toes will have to wait a little bit too. I don't know why everything is so far out, but that's pretty much every doctor. So I've got one appointment in August. No, yes, I do. One appointment in August, one at the end of July, so in a couple days, and then pelvic floor therapy September, October, depending on how that works out. And then I actually have my GI appointment already scheduled for, that's not a good day. They auto-schedule those, so whatever, it's fine. We'll make it work. I've got that for the end of September, so okay, we're like, we're getting things done. I want this to be motivation that if you've been putting stuff off, schedule your appointments. There are a couple of other things that I do need to get taken care of. The main one being my teeth. I've talked about it a little bit and I feel very ashamed to tell you guys, and I know I shared it at the time when it was happening. I know that I have to get my wisdom teeth taken out, and I found that out in 2018. I know. Well, life has been a little crazy since. The day that I had the dentist appointment where they told me I need to go to an oral surgeon. Apparently my wisdom teeth grow along the artery in my jaw. The dentist refused to do it. The day that I found that out, my dog, Daisy, was acting funny. And so I had a vet appointment right after that appointment. And she wound up passing away. So from that point, life turned upside down. Basically, you know, multiple surgeries over multiple years. It just felt like there were so many other things to focus on, including the barn and just, you know, now having a baby and stuff. It's been chaos. And I'm so afraid of the dentist. Anything with teeth. I do not know why. The stuff that they give you to numb your teeth so you don't feel anything for fillings, I feel it. It never works. They have given me, I remember the last time that I had a filling done, they gave me 4 shots in the same place and I still felt everything. So I am absolutely terrified of the dentist. I would rather get surgery and go through recovery from surgery than go to the dentist. But I need to do it. So that is something I am still waiting a little bit for because of breastfeeding, because I know wisdom teeth surgery removal, it's not just the anesthesia and stuff that I have to worry about with breastfeeding, but also I probably won't be able to eat very well afterwards, and that'll probably ruin my supply. I was hoping that I could take care of it before I had a baby, but she was a little bit of a surprise. So anyways, at least I'm getting a number of things done. The wisdom teeth, we're just trying to figure out how to schedule that, and then I'll go to the dentist after wisdom teeth. Ugh. It's almost time for Nova to take another nap. So anyways, guys, I feel good. I'm glad that I feel like filming this holds me accountable to schedule these appointments. So it feels good to have them. We'll see how pelvic floor therapy works out. I'm hoping it won't take me too long to progress. Actually, Zach, you know what? I was just thinking, the last time I went to pelvic floor therapy, I did essentially pay out of pocket.
And they reimbursed?
No, they didn't. No, because I had to pay $70 for a copay every time that I went. And then, remember, I got a huge bill after the fact. It was $150 per session. So 70 plus 150 is actually more than what this place charges.
Without reimbursement?
Without reimbursement. That was with insurance. That's what it cost with insurance last time. They covered a little bit, but I guess that was my portion to pay, which is kind of ridiculous. Anyway, that's fine. We'll figure this out, but thank you for coming along with me. Get your appointment scheduled. Take care of your health, even if life is crazy. It does feel a little bit hard because I'm trying to figure out when she's going to eat, when she's going to sleep, when Zach's available. Just got to make it work. Just got to get it done, I guess. Thank you, Element, for sponsoring this video. Where's my cup? I gotta keep sipping on this. I was too busy making appointments. Make sure to get a free sample pack with any order of Element by going to drinkelement.com/LetsTalkIBD. All right, guys. Thank you so much for watching. I will see you in the next. Bye, guys. Thank you so much for watching today's video. If you are looking for a way to help support my channel, consider liking this video or even subscribing. You can also check out my store at LetsTalkIBD.shop. I have stickers and hoodies like these guys over here, just related to chronic illness and inflammatory bowel disease, something fun. And I also have a coupon code for my YouTube watchers. You could also become a member of my channel like the wonderful people scrolling on screen here. They've become a member and they have access to videos a little bit earlier. It's a great way to support my channel, and really, just watching my videos means the world. Thank you so much, and I'll see you in the next.